So we get into the slightly more complex designs that we're going to focus on today. So we're going to take a look at designs that will help us answer questions such as if you have a treatment, if you have a treatment that you're designing and it might work for depression, people with depression, and it might work with people with OCD. So it's a new drug, a new pharmacological treatment, and you want to test whether it works on either one of those disorders. You cannot use the simple designs that we looked at before. You would need to use a more complicated, complex experimental design. Okay, so we have this factorial design. One of the great benefits of a factorial design is that it gives you a lot of freedom in terms of what it is that you want to look at. Because once you have a factorial design, you can look at the effects of each variable by itself, and you can also look at how each variable interacts with the other variables. So we'll start off with the simpler one, which is the variables by themselves. That's a main effect. So the main effect is each variable on its own. And if we were to ask in this configuration here, what is the main effect of item type? So you remember when we were writing up the results section, we would say, oh, is there evidence of a main effect of item type? That is there evidence that item type on its own affects our memory? Is there evidence that we are better or worse at recalling true memories versus false memories? That's what the main effect of item type means. What it actually boils down to in essence is saying, you know what, we've done this experiment here, but we are not interested in group levels anymore. We're taking all of our data, and instead of having individuals, pairs, and triples, we're just going to say we got subjects. We got subjects remembering false items. We got subjects remembering correct items. So how did subjects versus subjects do? Not individuals, pairs, and groups of three, but just how did the subjects do? Is there a difference between correct items and critical items? And as we saw, yes, indeed, there was a difference in percent recall between correct items and critical items. There was a main effect, and that's what this graph is indicating. This graph is collapsing all the data. So individuals, pairs, and triples are in here. Individuals, pairs, and triples are in here. And what this data is telling us is that, yes, all by itself, correct items were recalled more than critical items. All right, in the same way, you can find the effect of the second variable all by itself. So was there a main effect of group type? Did group size do anything on its own? And that's as if you said to yourself, all right, well, I tested singles, individuals, and groups of three, and I tested them for false memories, and I tested them for correct memories, but I'm no longer interested in the false versus correct difference there. So let's get rid of that difference. All I'm interested in is how much did individuals remember, how much did pairs remember, how much did triples remember, and that's what we have here. So this is the main effect for group size, and as you recall when we were writing it up, there was no main effect of group size, indicating that the amount of words recalled, the percent recall for each group on its own was in fact the same. So there was no main effect, no effect of group size. However, that, and this is one of the reasons we do factorial designs, that doesn't mean that group size wasn't doing anything. Group size actually was doing something, but that only came out in the interaction. So interactions are where the effect of one independent variable, what one independent variable does, depends upon what the other independent variable is doing. So the effect of one independent variable is dependent upon what is the level of the other independent variable. And the easiest way I find for people to conceptualize or remember the idea of interactions in an experiment is to think about an interaction that we're probably all familiar with, an interaction that we've probably all been warned off of, and that is the interaction between prescription drugs and alcohol. So when you get prescribed prescription medication, usually one of the things that it says is do not take that prescription medication with alcohol. And the reason for that is because of drug interactions. And what a drug interaction is, it is the effect of this prescription drug will change depending upon whether or not you've ingested alcohol. So let's say that you're taking a prescription drug, and let's say that let's say that it's a painkiller. You've just had surgery, your doctor has prescribed painkillers. Don't take the painkillers, you're going to be in pain. Take the painkillers, pain goes away. That's the effect of painkillers on their own. When you combine that with alcohol, it changes the effects of the painkillers. So without alcohol, take a painkiller, pain goes away. With alcohol, take a painkiller, you go to the hospital. You're destroying your liver, you need to get your stomach pumped. Different effect depending upon the level of the alcohol consumption. That's a drug interaction. What this drug does is dependent upon how much alcohol you have in your system, and that's why you're told, do not take this medication with alcohol. It's to avoid that interaction. So again, the prescription drug has one effect when you have zero alcohol in your system. The effect of the drug changes when you have more alcohol in your system. The effect of the drug interacts with the alcohol. So that's what we're looking for when we're talking about interactions. Does the variable do one thing in one situation and then do something completely different in another situation? So in our study here, we found an interaction of group type and item type. What that means is that the effect of group size for correct items was different than the effect of group size for incorrect items. So if somebody came up to you, another way to think about this is that if somebody came up to you and said, hey, I heard you did this experiment, what's the effect of group type? How does group size change memory? You would have to say, oh, it depends. It interacts. Are you talking about correct memories? Or are you talking about false memories? Because the story is different for correct versus false memories. The effect of group size interacts with the type of memory. So as we saw, for correct items, for the blue bars here, the larger your group, the better your memory. So memory improves, percent recall goes up as group size increases for correct items. But item type interacts with group size so that for critical items, there is no difference in percent recall as group size increases. So what's the effect of group size? It's just like asking, well, what's the effect of this prescription drug? It depends. If you have zero alcohol in your system, it's a painkiller. If you have more than 0% alcohol in your system, it could be a potential life killer, depending upon how much you have. The effect changes. That's what an interaction is. And the only way to find these interactions, which are oftentimes the most interesting parts of an experiment, is to have these two variables in your experiment. That's the only way that you can get to that potential interaction, is by having those two variables to see if the story is different for one level versus another of those variables. All right, any questions on interaction so far? Cool. All right, so let's take a look at a little bit more conceptual ideas or details about interactions. We'll keep it kind of basic. Let's suppose that you have two variables. You have variable A and you have variable B, and they each have two levels. You have one dependent variable that you're measuring, and you have two independent variables. What are the possible outcomes of this hypothetical experiment? So as it turns out, there's 8 possible outcomes. So the first one, or the first two, come from the fact that your variable A could do something or might not do anything, right? It could do something or it could do nothing. So there's two outcomes. Either it does something or it does nothing. Two possible outcomes for your first variable. For your second variable, there's two possible outcomes. Either your second variable does something or your second variable does nothing. And then finally, you have your two variable interaction. Either your two variables interact, so the level of one changes the effect of the other, or your two variables don't interact. They're independent. They act independently of each other. There's no interaction. And the kind of kicker to this, and the reason why it's so important to understand interactions, is that any combination of this is possible. Any combination of these three outcomes can be achieved or can occur in psychology. So it's very important to be able to interpret an interaction correctly, because if you just focus on the main effects, if that's all that you can that you understand, you're oftentimes going to miss the very important part of the story. So let's put these up visually here. We're not going to spend too much time on this part here, because this is where there's no interactions. So you can see here, just in terms of just setting this up, this is a graph of the effects. This is the two levels of variable A. These are the lines of the two levels of variable B. And here it says whether A has a main effect. So in this case it's no. Does B have a main effect? In this case it's no. Is there an interaction? In this case it's no. So these are the ones where either B has an effect or A has an effect, or they both do. But all of these are the no interaction cases. So we are not going to spend time on that. We're going to take a look at when there is an interaction. So in each of these cases, there is an interaction. In each of these cases, the effect of A is different for the different levels of B. But importantly, that can occur when, for example, B looks like it's doing nothing. It can occur when A looks like it's doing nothing. And it can occur when A and B both look like they're doing nothing. So it's quite possible that your main effects say, no, this variable does nothing, but your interaction says, oh yes, it does. It's just only coming out in the interaction. And that's why it's vitally important to understand how interactions work, because otherwise you might be missing a crucial portion of the outcome. So this is a little difficult sometimes to grasp hypothetically. So let's put a situation on top of this so we can anchor our thoughts. We'll go back to that clinical treatment of depression and OCD. So let's say that you work in a clinic that treats people with depression, and you work in that same clinic and it also treats people with OCD, obsessive compulsive disorder, and you develop a new technique, a pharmacological drug that you're hoping will cure depression and or obsessive compulsive disorder. So what you would do is you would have the type of disorder, depression versus OCD. That's one of your independent variables. Either you have depression or you have OCD. Your other variable is their level of function before the treatment and then after the treatment. So you have them before they take the drug, you have them after they take the drug. Before or after is your second independent variable. So we have that here, where we got before the treatment, after the drug treatment. And then here we have a scale of mental functioning. And this would be a sort of generalized test of mental functioning that you could give to any disorder to measure how are they functioning in general. And basically higher scores indicate better functioning. You want your drug to give them higher scores. All right, so we have pre versus post. That is the A variable. We got mental functioning. That is B. So we have pre versus post. A, yes, there's a main effect. We're going to see that mental functioning is better in post. B, on the other hand, says that there's no main effect. What this means is that in general, there was no difference between the functioning of the OCD individuals and the functioning of the depression individuals. There's no difference there. If you don't understand the interaction, you might say to yourself, great, my drug works, and great, there's no difference between depression and OCD. It's a drug for both of them. It's a cure for both individuals. This interaction says, no, it's not a cure for both. And you only get that when you understand the interaction. So what's going on here? Well, this is the outcome of what occurred. So in this case, your OCD patients, they started off with really low mental functioning before the drug. After the drug, their mental functioning skyrocketed, right? It went from 1 to 9. Your depression individuals, they started with a medium level of mental functioning, and your drug did nothing. It did nothing for these individuals. So when you're taking a look at this interaction, and you're asking yourself first, was there an effect of the drug on its own? Was there a main effect for the drug? What you're asking is, in general, was the functioning before the drug lower than the functioning after the drug? And if you take a look at the average level of functioning before and the average level of functioning after, yeah, it's higher after. So in general, people were better off after taking the drug. In general, there's a main effect for the drug. So that's the main effect for the drug right there for OCD and depression. If you then take a look at B over here and you say, oh great, there's no difference between OCD and depression levels of mental functioning, you would be tempted to say, yeah, this is for both of them. I have a drug now that's great for both. Where did this come from? It came from the fact that it came from the fact that the average level of depression across the entire experiment, we're not talking pre or post anymore, the average level of depression is 5. Your average level of OCD is the average of 9 and 1, that's also 5. So on average, your depressed individuals and your OC individuals have no difference on their in this experiment. So that doesn't mean that your drug works for both, because it comes out in the interaction. And the interaction is saying, yes, you got a wonder drug for OCD, you have nothing for depression. It does absolutely nothing for depression. So if you only understood the main effects, you would erroneously say, oh, I got a drug that works for both. Great, that's perfect. Once you understand the interaction, you can see that, well, no, this is great. I got a drug for OCD. I'm going back to the drawing board for depression. Give you another example of why it's very important to understand interactions, why it's very important to have factorial designs where you can take a look at interactions. So let's take a look at this one here. Take a look at the main effect on its own. No main effect for pre versus post. So they were no better off. Your subjects were no better off after taking the drug than they were before taking the drug. Well, that's horrible. Was there a difference in mental functioning between the two disorders? No, there wasn't. So not only was there no difference between the two disorders in how they were functioning, but there was no difference in how they were functioning before and how they were functioning after getting the drug. In this case, you would probably say to yourself, again, if you don't understand interactions, you would say, well, my drug is doing nothing, and there's no difference between the two disorders, so back to the drawing board. Let's, that's it, we're done. I was really hoping for this treatment to be a new treatment, maybe to help people, but it looks like we're back to the drawing board. We'll throw it all in the trash, right? So you wouldn't do that, but anyways, that would be a mistake, because here there's an interaction. And what that means is that the true story, the real story, comes out in the interaction. And this is oftentimes seen in what's known as a crossover interaction. So how did we get no effect for pre versus post? Well, if you take a look at performance before the drug, some of your subjects were scoring 1, some of your subjects were scoring 9. Average of that is 5. What happened after the drug? Some of your subjects are scoring 9, some of your subjects are scoring 1. That's an average of 5. So there was no change in general pre to post. There was no change in mental functioning from before or after. And then if you take a look at, well, what about obsessive compulsive disorder individuals across the entire experiment? Well, they scored a 9 and they scored a 1. So on average, they had a mental functioning of 5. What about depression subjects across the experiment? They scored a 9, they scored a 1. So on average, they also had a score of 5. So there was no difference between the scores for the two groups of subjects. So this is what the result looks like when you take a look at the main effects. This is back to the drawing board. This is a waste of years and time, and you've got a treatment that does nothing. This is half a miracle drug and half a important insight into what is going on. So this is the interaction. That comes out here. This is saying that regardless of the fact that you have no main effects, the story of how your drug affects OCD is different from how your drug affects depression. The treatment interacts with the type of drug to give you these different effects. And what you have here is you have two wonderful things. Number one, you got a miracle cure for OCD. You got something that'll take them from a functioning of 1 all the way up to a functioning of 9. That is a super cure for OCD. Not only that, but you basically have depression poison, right? You basically have something that you can give people that will increase their depression. That gives you a clue as to the cause of depression, because whatever your drug is doing, whatever brain area it's affecting or hormone it's releasing or bodily change that it's making, that is what is causing depression. That is what's making depression worse. So you found poison for depression, which means that you're that much closer to finding a cure for depression. And again, none of that would come out by just looking at the main effects. It's very important to understand those interactions.